Hello everyone. If you're watching this, then you or somebody you love is suffering from a thyroid dysfunction. So what we're going to talk about today is some of the natural approaches and metabolic protocols in order to help you with your thyroid problems. My name is Dr. Aubry Tager and I'm a chiropractor. I specialize in functional medicine and functional neurology in South Burlington, Vermont. I am licensed in the states of both Michigan and Vermont. I hold a postdoctoral certificate from the American Functional Neurology Institute. I am board certified in integrative medicine, and I serve on the executive board of the American Association of Integrative Medicine. I am board eligible for chiropractic neurologist, and I studied under Dr. Ted Carrick as far as functional neurology goes, and blood chemistry and advanced thyroid management under Dr. Michael Johnson. Now, three things that I want you to know today. The first thing is I want to be able to reinvent your life. I want to be able to help you in dealing with the condition that you're suffering from. The second thing is I want to have a maximum positive impact on every single human being that I come in contact with, especially in my practice. Now, the third goal for me is that I want to make sure that you have some form of an exit strategy for your health concerns. We really want to make sure that you have an idea of how you can possibly get better. Now, when we look at something like the thyroid, what we see here is we see the larynx, and there are two sides to it. There's a right thyroid gland and a left thyroid gland, and then we have the trachea. Now, there are a lot of different symptoms when it comes to thyroid dysfunction and thyroid disorders. One of the main things that we have is fatigue. If you're tired all the time and you don't understand why, maybe you're having difficulty getting through the day, 2 to 3 o'clock in the afternoon, you don't understand why you're just getting extremely tired, this could be something to look at. An increase in weight gain. If you're trying to eat healthy, we see this a lot with a lot of my patients. You're eating relatively healthy and you don't understand why you're not able to lose weight or why you're not able to maintain a normal weight. You're still overweight, maybe even obese, but you don't eat 10,000 calories a day. Well, there could be an issue there. Are you having morning headaches that wear off as the day progresses? Do you have depression in the morning or depression any time during the day? Are you suffering from constipation? Here's something that people don't normally associate with thyroid symptoms or thyroid dysfunction is, are you having difficulty with sensitivity to cold weather? Are you living somewhere cold and you just really can't get warm? You're always cold. You feel like you're just stuck out there with your feet in the snow and you just really can't get any relief. Well, this could be due to poor circulation and numbness in your hands and feet brought about by thyroid dysregulation. You might also be suffering from cramping in your hands or your feet. A lot of my patients, they'll go to bed at night and they wake up in the middle of the night because they have just tons of cramps. They're not feeling well. Do you have wounds that are healing slowly, that are really not getting better at all? And do you find that you're just sleeping way too much? Do you find that 8 hours, 10 hours just is not enough for you, that you just really feel like you can't function unless you get 10 to 12 hours plus multiple naps throughout the day? Now, this is something to be concerned with. If you're really dealing with things like this and you feel like you can't get through the day, then there are some other issues there. Are you suffering from dry or brittle hair? Do you see that your hair is falling out easily in clumps if you're in the sink or in the shower? Are you noticing things like edema? Are you noticing any loss of your eyebrow? Maybe the outer part of 1/3 of your eyebrow is missing or is very thin. These are all indications that there may be some form of a thyroid problem there. Now, something that a lot of people aren't aware of is that every cell in your body has receptors for the thyroid. This is amazing. We're talking about everything here. Your heart, your stomach, your lungs. Everything that functions is going to have a receptor for the thyroid. Now, are you sick and tired of going to the doctor only to have nothing truly done to get your results? Have your blood tests been normal and you're still wondering, well, how come nothing's changing? If it says that I have normal thyroid tests, then why am I still suffering from all these problems? Maybe the doctor that you're currently seeing is not doing the right testing. Maybe they're missing out on something. That's not to say that they're not good doctors, but they might be just missing out on specific protocols and on different testing. Now, how long have you had this thyroid? Is this something that's been going on for years? I know a lot of you are going to ask this question. Why doesn't my doctor, why doesn't my endocrinologist or my internal medicine specialist know about this? Well, they might and they might not. Now, the overwhelming majority of doctors, whether it's chiropractors or medical doctors or podiatrists or DOs, whatever it may be, they're not reading the up-to-date journals. There are some that do, but there are many that don't. And for those that don't, the way that they get their information is generally through the medical representatives, the pharmaceutical representatives that come into their practice and are giving them studies after studies. And when they see those studies and they're looking for the next best thing in order to help with those studies, what it's going to be is it's going to be a pharmaceutical agent, something that's going to help them, a drug that's going to help based on the study that that pharmaceutical company was given. So it's not the fact that your doctor doesn't want to know things, it's the fact that they're overwhelmed with a lot of these pharmaceutical representatives coming to their office, and that's how they're getting a lot of their information. This information might not be the best thing for you, but it is how they are getting it. Now, they're also relying on what they learned in school, maybe 15, 20, or 30 years ago. If they're not up to date, they might have missed out on some of the newer techniques and some of the newer protocols that's out there. So, if you're suffering from any of the symptoms that I just spoke about, then you're suffering from a web of physiological dysfunction. A web of physiological dysfunction is a combination of things. You're not just going to be suffering from one problem when you're having thyroid dysfunction. You may be having a specific chief complaint, but that one chief complaint is going to be encompassed by a myriad of different symptomatology and of different areas. So you could have problems with your mind and body, and what ends up happening there is you end up having poor results, poor performance, unhealthy beliefs. You may have immune system balance. You might be having problems with adrenal function. So when you have one chief complaint, it's not going to be focused just on one specific problem. It's really going to branch out into a lot of different issues that we see when we're talking about things like thyroid dysfunction. Now, you may have brain problems, nerve problems, thyroid problems, gut problems. You may have all of these different things, even metabolic problems and short-term memory problems. Is there a pill for this? Why can't I just take a pill? Well, it's unfortunate, but they don't make a pill just for that. It would be much simpler if there was a pill for everything, but our bodies don't function that way. So there's no really quick fix. There's no one pill cures all for this. So we're going to talk about this web of physiological dysfunction. Now, your brain specifically has different functions and it may be affected. If your frontal lobe is affected, then you might have noticed that you're suffering from different personality changes, maybe depression and anxiety or irritability. Has your husband or your wife, have they noticed or said anything to you that you're just not seeming right, that you're really reacting to things rather quickly and you're really just not your day-to-day self? Now, if that's the case, then there may be a problem in that frontal lobe. Now, you might be suffering from a problem in the hippocampus, and this is where you store your memory. So if you're having some problems with short-term memory loss, there may be an issue in the hippocampus. Now, your parietal lobe. Your parietal lobe is at the back part of your brain here, and in specific areas, what we call areas 3, 1, and 2, this is where somatosensory information is stored. So a lot of tactile stimulation that's coming into your body, this is where it stores. All this sensory information fires into your brain. So if you're having increased numbness and tingling and pain, then there could be a problem with that parietal lobe. Now, how many pills are there out there to fix something like the parietal lobe? Well, if you have short-term memory loss, how many pills are there to fix short-term memory loss? It's unfortunate, but there aren't any. None that I know of. So let's look at your brain. It controls every function in your body. If your brain is having an issue, then how is it going to send the messages to your pituitary gland and down through the rest of your glands in order to get your endocrine system started? It all starts with the brain. If your brain is malfunctioning, it's going to affect every part of your anatomy. The nerves go to your organs. Your nerves are going to go to your heart, your stomach, your lungs, your muscles, your eyes. Whatever you have that functions has to have a nerve going to it, or it's not going to work. Now, if you don't believe this, go and take a look at any anatomy chart, and you're going to see that all of these nerves are going to come right back to the spinal cord. Now, in order to improve your health, we have to understand how you got here. Let's first look at the hypothalamus. So this starts in your brain. We see that the hypothalamus is going to release TRH, thyroid releasing hormone. This gets sent down to your pituitary gland. And your pituitary gland is extremely important because this is what really is going to get the ball rolling. The pituitary gland is then going to send TSH down to your thyroid gland. But when that gets to your thyroid gland, 93% of that is not usable. It's not a usable form. Only 7% of that is usable. So how do we convert that in order to make it usable so that we can actually make use of T4? Well, the way that we do that is the TBG is actually taking T4, so this is thyroid binding globulin, and this is going to take this, kind of think of it like a taxi cab. It's going to take it in to the liver, and that's going to convert it to the usable form of T3. So T4 gets down, and then the active form, T3, gets converted 60% of it in your liver, 20% of it in your gut, and 20% of it in your other tissues. So if your doctor is not testing your liver, if he's not doing a full thyroid panel, if he's not testing your gallbladder or your adrenal glands, then you can see how we could be missing out on something with regards to your thyroid. Now, your hypothalamus is going to send the signal to the pituitary gland via thyroid releasing hormone. This is what we just talked about. As this goes down to the pituitary gland, then the pituitary gland is going to send a signal via thyroid stimulating hormone down to the thyroid gland. TSH is going to cause an enzyme TPO to stimulate the release of T4 and T3. These hormones ride the taxi cab of thyroid binding globulin, and that's where this conversion is going to take place. It gets converted from T4 to T3 in the liver. It also happens in the gut and in our peripheral tissues. So when T4 is transformed into the active form of T3, then it enters the cells via the cell receptor sites. But we have to make sure that we have that conversion. So if we're just looking at the amount of T3 that's available and we see that it is fine, then we're going to miss out on 94% of the actual hormone. Now, how many doctors have you been to for your thyroid problems? How many have looked at your brain or your colon? How many are they just looking at TSH? We have to look at that conversion of T4 to T3. We have to realize that 90% of your food is assimilated in the small intestine. 80% of your immune system is in your gut. If it's malfunctioning, then that's not going to allow you to heal properly. Now, how many of you have had your gallbladder removed? And are you still suffering from symptoms that are associated with the gallbladder? Your liver is extremely important for thyroid conversion as well, as we just talked about. T4 to T3. 60% of that conversion is occurring in the liver. We've got to make sure that when you have any kind of thyroid dysregulation, that we're looking at the liver. Now, one of the good things about insurance in our country is basically it keeps incompetent doctors in business. If you're not seeing the doctor because he is good, you're seeing him because maybe your insurance covers him or covers his services. That doesn't help you. You want to make sure that you're seeing the best doctor, and don't worry about whether the insurance covers it or not. I understand that that can be an issue, but you really want to make sure that you're not just going somewhere simply because your insurance covers it. You don't want the insurance company dictating the type of care that you have. You want to make sure that you're getting the proper care. Now, if that care is covered under insurance, that's fantastic. But don't let the insurance companies run your health. The only thing that matters to me and to everybody in my clinic are results. If my patients are not getting results, then they're not getting better, then it doesn't matter. Nothing matters except for results. 70 to 80% of your immune system is in your gut. So if you're suffering from poor gut connection, then there's going to be a major problem. The father of medicine, Hippocrates, said, "Look to the gut. You will find the origin of almost all human illnesses in the gut." If we have any kind of parasites, if there's any kind of bacterial or viral infection, and the gut can't fight this off, there are literally 1 trillion different bacteria in the gut. So if you don't have the good bacteria that's there and the bad ones are going to keep reproducing, you're going to have problems and you're not going to be able to heal properly. Now, anything that causes your immune battle in your gut will trigger inflammation or an inflammatory process. This includes things like food sensitivities, chronic infection, parasites, mold, fungus, yeast, virus, undergrowth of good bacteria, or the normal flora. Now, poor gut function is almost always due to the following. It's almost always due to food sensitivities. It could be to gluten or dairy or soy, or maybe you had an infection or unhealthy bacteria. You might even be suffering from leaky gut syndrome. How would you know that this is going on, and what does this have to do with your thyroid? Well, if that immune system is not working properly, do you think that your thyroid is going to be able to work? Do you think it's going to be able to heal? Probably not. Now, blood sugar and your brain. Your brain needs two things to survive. It needs fuel and activation. So fuel comes in the form of glucose and oxygen. And if you're not getting enough glucose to the brain, or if it's not regulated properly, you're going to have issues. Your adrenal glands. Your adrenal glands are your stress glands. They sit right above your kidneys. And when they are under stress, it could be physical stress, emotional stress, environmental stress, they're going to release a hormone. And the hormone that they release is called cortisol. Well, cortisol, if it's made in excess, if you've too much of it, then what's going to happen is that's going to become toxic. It's toxic to your brain. So when you get that buildup of cortisol, mostly your hippocampus, that part of the brain that we talked about that's going to store your short-term memory, is going to be affected. So if you have too much adrenal stimulation and you're releasing too much cortisol, do you see now how that can affect your brain and how that can affect things like your memory? Now, there's a direct correlation between the adrenal glands and cortisol destroying your glands. The adrenals also release epinephrine and norepinephrine, which stimulate pain fibers. So if you're going to have an excessive release of cortisol, then there's a very good chance that you could be suffering from an increase in the amount of pain. This is what we start to see when people are suffering from a combination of thyroid dysregulation and pain, and they might even be suffering from chronic pain types of syndromes like fibromyalgia. So your thyroid is actually going to be able to cross-talk with your immune system. Your thyroid is communicating with your gut. It's going to communicate with the rest of your endocrine system. Now, when we look at things like the communication between the hypothalamus and your pituitary, your hypothalamus and your pituitary axis is going to control your thyroid hormones, your adrenal hormones, and your male and female hormones. So things like testosterone, progesterone, and estrogen. So a problem with one is going to lead to a problem with the others. So can you see now how this is not just going to be something that is isolated? Now, have you been told that all of your lab tests are normal, but you're still having problems? My doctor said there's nothing wrong with me, so why do I feel so lousy? Well, maybe they're just not running the right tests. Same labs, different results. Well, when you look at labs, They're using bell curves. Think about all the people that are going into a lab. Is it generally a healthy person that's going in there saying, you know what, I really want to get my blood tested? Usually it's people that are not well, they're sick. So when they're taking those averages are from really sick people. And they're very broad. It's a broad range. It's a pathological range. We want to really be focused on a narrower range, and that's what we call functional lab values. Now when we look at abnormal low values and abnormal high values, it's a pretty broad spectrum. We want to make sure that we're closer in here, in the functional range. So how does that work? Well, let's take a look at something like glucose. Normal blood glucose could be anywhere from 85 to, or even 80 to 120 was a traditional thought. Now, the functional range is between 85 and 100. So, if you're coming in at 73, then you have hypoglycemia, or a lack of glucose. You might also be at 120. And if your blood sugar level is at 120 on the higher end of the spectrum, what's your doctor going to tell you? He's going to say, well, looks like you're borderline diabetic. We'll wait till you become diabetic, and you know what, then we'll give you some medication for it. But right now, there's really nothing we can do. Well, if you happen to be at 115 or 120, then you have a problem. And why would you wait until this destroys the islets of Langerhans, the parts of the pancreas that are releasing the insulin to battle the glucose? Why would you wait until that's destroyed? Why not address it right away if you know that there is some sensitivity, that the insulin sensitivity, that you're having problems releasing that insulin? The same thing here. When we look at something like TSH, the normal TSH is between 0.3 and 5.7. The functional range is between 1.3 and 3.0. So we want to make sure that that spectrum is a lot closer. We don't want that broad spectrum. We want a narrow result. Same with cholesterol, your triglycerides, and the rest of your blood work. When you come into my office, if you bring in your blood work with you, we'll sit down, I'll go over all of this with you, and I'll be able to tell you where you are functionally, if you are in the normal limits. Maybe you're not. And what does it mean if you're not in the normal limits? What are the consequences of that? We will go over all of that as well. Now, typical thyroid tests that get ordered are TSH, which is thyroid stimulating hormone. And if you're lucky, maybe they'll order total T4, which is thyroxine. When you compare this to a true thyroid function test, where we see TSH, T4, but what about all these? Free thyroxine index. That's the amount of free T4 that's available. Free T4, T3, FT3, reverse T3, TPO, and TBG antibodies. How would you know if you had an autoimmune thyroid condition like Hashimotos or Addison's disease if you didn't have these tests run, TPO or TGB antibodies? What about TSH antibodies or TBG levels? The bottom line here is you've got to make sure that whether I order it or whether your physician orders it or somebody else orders it, you want to make sure that you have a full thyroid panel. If you want to see something that's normal, then go and sit outside Walmart and you can see all the unhealthy people walking by. That's what normal is. We don't want that. We want to make sure that you are healthy, not that we're just seeing normal. Normal is not what we're seeing on an everyday basis here in the United States. That's not good. Now, when we look at Hashimoto's disease and Graves' disease, Hashimoto's is hypothyroid. So what that means is that it's going to be hyperthyroidism and hypothyroidism. It's going to go up, it's going to go down. With Graves' disease, what we see is hyperthyroidism. So it really goes, your thyroid is going too fast. These are not typically real thyroid problems. Your immune system is causing this. Your immune system is mistakenly attacking TPO or TBG, and these are immune problems. This is an autoimmune response. There's an imbalance in your immune system that needs to be addressed. And how are you going to know that? You're going to do the proper testing. Now, we want to look at any kind of hormonal problems, blood sugar involvement, adrenal involvement, brain involvement, and don't forget the HP axis feedback mechanisms. So when you have one chief complaint, we're going to get back to that entire web of physiological dysfunction. The typical medical approach is wait until the tissue destruction is so bad that we squash the entire immune system with steroids. Then take an antidepressant and hope for the best. What we want to do is we don't just want to be treating the symptoms. We want to be looking at the underlying causes of these metabolic problems. How do we do that? Well, the functional medicine approach, as opposed to the more common traditional medical approach, is to remove all of the immune triggers. So things like food sensitivities, infections, unstable blood sugar levels, adrenal dysfunction, hormone dysfunction, thyroid, liver, gallbladder dysfunction. What about supplements? Are they causing some of the problems? We want to take the neurometabolic approach, and that's modulate the immune system. Use dietary modification and change your lifestyles. We want to make sure that you're getting the proper supplements based on lab findings that show what your body specifically needs based on its function, not just based on something that somebody's telling you to take behind the counter at GNC. We want to look at the whole person and not just the condition itself. You can start off by treating things symptom-wise, just like medicine, and take a bunch of medication. Or there's another approach where you can go to a naturopath or a chiropractor or somebody that's going to take a more natural approach and do the exact same thing. You're taking a symptom-based approach and you're just replacing that medication with something that's more natural. That's better, but what we're trying to do here is we're trying to take the functional medicine approach, where we're looking at the underlying cause of the problem and trying to correct that. We want to make sure that we look at the whole person and not just the condition itself. So life is a matter of choices. My goal here is to reinvent your life, and I hope that I have done that, because for me, knowledge and action equals results. Without results, none of this means everything. So I want you to ask yourself, what can you improve in your health? How are you going to do that? Well, first and foremost, you should schedule an appointment. Then I want you to ask yourself, what would happen if you didn't schedule an appointment? How's your life going to change? What's going to cause you not to decide to do this? Now think about where you're going to be in 3 years from now if you don't fix your problem. So life is a matter of choices. If you like what you heard here, then what I want you to do is I want you to let me help you. That's the bottom line, is I'm here to try and help you. I want to get you better. So in order for me to help you to reinvent your life, you need to set an appointment. Generally, for an appointment, it's about $450 or so for the test. But if you're watching this video, call my office and we'll set up an appointment for $60, and that'll give you a full comprehensive evaluation. We're going to go through your history, a lot of paperwork. I'm going to go through a comprehensive neurometabolic workup, and then I'm going to give you my best recommendations. So you'll come in for a full neurological examination and case review. If you're going to do this, I want you to bring a t-shirt and a pair of shorts with you so I can do a thorough exam. Now, when you come back in for your report of findings, so that you can sit down and I can give you my best recommendation, I really need you to have your significant other or your spouse there. They need to know what kind of problems are going on there, and they need to be your support system. So I really need you to make sure that when you do come back, that you come back with your support system with you. So if you have any other questions, don't hesitate to call our office, area code 802-230-4678. Once again, my name is Dr. Aubry Tager, and thank you for watching this video on thyroid dysregulation from Get Healthy Vermont. Thank you, and I look forward to seeing you soon.